Today, if you want to know how to manage tough conversations with athletes, you have to tune into this episode. Hi, everyone. Welcome back to the podcast. Welcome all new listeners and welcome back to those who've heard my content in the past. Today, if you want to know how to manage tough conversations with athletes, you have to tune into this episode. Before I go on to the podcast, what is new? What is better in life? Gosh, there is so much good chaos happening right now. If you've been on the podcast for a while, I'll give you guys updates. First of all, my kids are doing fantastic. Zachary is becoming popular with the ladies at school. Jacob is almost at his first 2 to 3 words combined, so I'm excited about that. And my daughter Alex has finally, I'm really excited for her. She went up in levels in gymnastics, so she's now in the big girls area. So I'm really excited for her. So what is happening with me? This goes with the podcast today. I am managing good chaos. There's always things happening in life, personally, professionally, all the above. And I think you naturally get better at managing it, or it increases your stress, your anxiety, your thought process, and everything else. And today, if you've listened to the podcast for a while, this is a great one. This will give you perspective. If you're new to my world, this might be a little much for you, but I promise it will make a huge impact on your profession. My wife, she's doing great. We just went to a wedding last night and just enjoyed the time. It was amazing. So it's always refreshing to reflect on marriage and what that means for you as a person and for two people coming together. So it was good to get a little refresher on that. So all right, on to this podcast. Why are we talking about managing conversations? Because I've had numerous PTs that I mentor. Everyone hides, all PTs hide behind the blanket of, what exercise should I do? Is this the right weight? Is this the right form? Is this the right box jump height? Should I be running them at week 13? And those are all, I think it's a shell. I think it's only questions you know how to ask, when in reality, there are better questions and better conversations that you need to be having with your patients and athletes that will dramatically improve your outcomes and your job satisfaction. I promise you. And we're going to talk about that today. And this came from a conversation I had with somebody about a tough client case or patient case that they were having. And they wanted to know more about what exercise should be doing early on, at what phase, when should they transition them out to return to sport at 13 and 14. And I said, I think you're too lost in the weeds. I think that you are looking at something that is looking at you, but you're not looking at it. And they were very confused. And I said, listen, what if you allowed the athlete to make that judgment? And they were like, wait, why? And I was like, we as PTs, we want to give the solutions, right? That's our obsession. We want to just constantly provide solutions. And that is a great environment to be in, and that's a great framework to work off of. However, a solution only works when, if there's two parties involved, if those two people agree to that solution. And sometimes I think that sports PTs hide behind exercises. They hide behind their initials or their expertise. And I think the best sports PTs involve their patients and athletes into that plan. And I'm going to give you a couple tricks and tips. And your goal moving forward is to help people overcome pain, get back to sports, do whatever they want, right? But you can't do it hiding behind an impairment-based, exercise-based approach. And what that means is you naturally go towards the special test, the impairment that's going to solve the problem, that's magically going to make them pain-free. When in reality, it took so much of tissue trauma, stress, load to be able to get to this point. And one exercise, one treatment technique might get them pain-free, but it doesn't solve their long-term problem. And your job as a provider is to provide those solutions. And I enjoy this part of my job the most. The most. It's a thing that I've probably strengthened over the last decade in mentoring physical therapists, because now I can understand like what you guys need and want. Truly, like you ask for exercises, but you want higher level thinking, like what is it that I'm missing? How do I, what is it, what's going to hit them that, at week 7 that I don't know yet. And so I can start to prevent and have that conversation. And managing conversations is really the long-term solution. Physical therapists, we typically, and we've been born looking at ankle joints, mechanics, and the solution to that has always been exercise and rehab progression, right? Or movement quality, blah, blah, blah. When in reality, we think that that's solution, right? And then you look at the patient and the athlete. If you ask them truly what the patient wants is to be independent, right? To be able to think for themselves, manage the injury by themselves, but have support along the way, and be able to know how to be more conservative or aggressive on their own. That's probably what they want the most. And I think most of you are shaking your head right now. You're like, yeah, that makes sense. That's what patient athletes want. And that's what our profession advocates. But the reality is, if the PT is focused on the impairment and the exercise, how does that provide long-term solutions to independence, allowing them to push and pull, now knowing how to be aggressive and conservative? That does nothing for it. The exercise is just a temporary, it's like Tylenol. I think exercise is an impairments-based approach is like ibuprofen or Tylenol. That's all it is. All you're doing is you're giving them temporary pain relief. The long-term solution is educating them about exactly what's going to happen, continuing to see them so you can understand, you're pushing too much here, you're doing too little here. They're not exercise specialists. They're not fitness gurus. They're a person who enjoys running and they don't know how to run and they don't know the volume. They know how to control it. Your one exercise doesn't teach them how to control the volume, how to improve their form, how to do all those things. And that takes 6 to 8 weeks, bare minimum. Once you're out of pain, you got 6 to 8 weeks to get them out of pain, 6 to 8 weeks to get them strong, and then additional 6 to 8 weeks to work on running form, minimum. So by only giving them exercises and working on the impairments, you're only giving them Tylenol and ibuprofen. Good for you. You're becoming the primary care physician that people talk about. Not all primary cares do that, but so the best way to go about this is managing tough conversations with athletes. Now, we can have a brand new athlete who has a different expectation. We have a complex case of an elite athlete and that's having tough conversations. Your job as a clinician is help managing expectations and having good conversations with people. You are not an exercise specialist. You're not a movement expert. You're not an exercise specialist and you're not a movement expert. You're a problem solver. And you do that by managing tough conversations and setting expectations. That's really what you are as a clinician. And so what you do is, let me give you an example. You have an athlete who says, hey, I have a sprained ankle and I want to play in 4 weeks. Your first instinct is, well, let me look at the tissue, how much swelling is in there and blah, blah, blah. And then like, here's a great exercise. And then you take it week by week and hope that they make it, right? The better solution is like 4 weeks out, if they need a sprint at week 3, they need to be able to do plyos at week 3, run at week 4, do practice at week 3, plyos at week 2, week 1, shoot, what am I doing? And now you're like, okay, wait a minute. So now what's your job? Set the expectation, have a good conversation. So if at 4 weeks, gosh, you know what, athlete, 4 weeks is very tough. It's possible, but we're just going to have a very short timeline. And here's what I think. These exercises at week 1 are going to help get you there. Week 2, we're going to get you into plyos, which means you have to be healing and not messing this up. At week 3, we're going to be running. At week 4, we're going to be practicing. How does it sound for you? And they're like, yes, that's the solution I've been looking for. Now let's compare that with orthopedic PT, old school, impairment-based exercise specialist. Well, you know what? Here's the great standing exercise on a wobble board while you like close your eyes and do all this stuff. And here's the TheraBand exercise. And here's the new creative thing that you see on Instagram or YouTube. Those things don't get them better, faster. And if they do, it's just a temporary pain pill. Yeah, but now you're at week 3 and you got them out of pain fast. Good for you. You're applauding yourself, hand on the shoulder. You still have 1 week to get them sport. What do? You forego everything. And you're like, well, just go back to sport. What you did was you skipped a whole phase, 2 phases of building their endurance, building their strength, and getting them ready for plyos and power development. So PTs, we're horrible at setting expectations because you don't even know what they are. And the only reason you're having a tough conversation is because it's too late. The goal is to have the tough conversation at the beginning of the entire relationship. But that means you set the expectation. In order for you to set expectation, you have to know what their plan is and their roadmap. So if I say, hey, so if just like this PT asked me recently, hey, I've got somebody with a hernia, and they have to be back to sport in 3 months. Perfect. All right, now we're mapping this out. Now we're talking. Awesome. And I said, where do you need my help? They said, hey, I need help with maybe some exercise or when to insert thing. I was like, no, you don't. What you really need to do is you did 3 months. Where are they going to be? Where's the time to peak? Where do they need the most fitness, most health? When's the latest I can get them 100% better? Well, month 2, say. So we got 2 months. We have 8 weeks to build this up. So we only have 2 phases to go through. We have neuromuscular control, maybe some muscular endurance, and then we're going to transition to the strength and power development. You have 2 phases, 8 weeks, break them into blocks of 4, and then fill the gaps. Well, what do you do in muscle endurance? You do 15 repetitions. Neuromuscular control, 12 to 15. In strength development, you go 8 to 10. On power development, you do 3 to 5. So there's your gaps. Every 2 weeks, you're changing up the parameters and you're ready to rock and roll. Where do you need my help with exercise? I don't. Yes, correct. So now at the point is now you have to have that tough conversation with that athlete and say, hey, you only have 8 weeks. Can we do this? And is this feasible with you? That tough conversation becomes a expected conversation. You're setting the targets, you're setting that goal. And when you can do that, that's when athletes love you. That's when they totally understand you. If you're new to this and you're like, wait, what are you talking about? Listen, I'm telling you to get away from the exercise impairment-based approach and think bigger. Figure out what people's expectations are. How soon do you want to get better? 12 weeks. Sounds good. Now set the expectation. Well, we got to figure out in the first 4 weeks, we're going to actually just get your mobility and movement strong, develop a good base. From that, for the next 4 weeks, we're going to build some endurance and some strength. Great. And then from there, we're going to actually develop into muscular hypertrophy and power development. You're going to be ready at week 12, athlete. You'll actually be ready, and you'll be, I mean, even if you have some bumps and bruises, we got plenty of time. Now, what you did was you set the expectation. Now you got to say, great. What challenges do you think you would have with that? And where do you see yourself? Oh man, what does the athlete do now? Nothing. Sounds good. Now fill the gap. Do the exercises. Do your job. I've done mine. Set the expectation. Here's a solution. Let's go. Those are tough conversations to have. So anytime that you're having a tough conversation, what's the end goal here? And what's my timeline to get there? And what resources do I have? And if you can do that with every athlete, like I'm not here to tell you the best exercise is this, you should be doing this and really focus on, staying positive, blah, blah. Like your goal is to truly do this for people, and it's their job to fill that gap. And if they don't do that, it's their fault. But you as a clinician are helping them at a higher level than here's the mobilization to help you relieve your pain with a front squat or whatever it is. That's great, but what's my timeline and what do you truly need? Once you do this and you manage expectations, guess what? People come in with questions. They come in motivated. They're like, hey, I tried this, I did this. What do I do next? You're like, oh my gosh, this is amazing. They're not relying on me to give every single answer. They're coming in with questions, and all I have to do is field those questions. That, as a clinician, is more rewarding, more fulfilling than I didn't do my homework. What should I do now? And all that pressure is on you, and you feel overwhelmed. Imagine seeing 8 people like that. I didn't do anything, not really motivated, didn't really happen. Have the tough conversation from the beginning. What is your expectation? How soon do you want to get better? What's your target? Let's work backwards, create that plan, and guess what happens? They're like, oh, you're giving me the accountability. Yes, I'm sick and tired of it, Mrs. Smith. I'm the one who's been taking this all, and I haven't had that conversation with you. And I appreciate you, and I love everything about what you're trying to do, and I want to maximize that outcome for you. So what do you have to do? Have that tough conversation. So my target to you is stop being an impairment-based exercise specialist. I know that's what our profession advocates, but I want you to take a step further. This is what I'm passionate about. This is what I'm telling you. Patients and athletes want this, and we just have been missing the whole thing the entire time. We're just so narrow focused, and I want you to take a bigger step out. So first step to do at the beginning of the sessions, anytime you're having a tough conversation, if you're having a tough conversation, it's probably too late or something didn't go wrong and you didn't forecast that. So it's already too late. The best thing to do is have tough conversations on the front end. Figure out what their timeline or expectations are. Love that. You want to get better by blank. Love that. So now if I have 10 weeks, now I can chunk that into blocks. How much time am I going to invest in each block to be able to get them to the point that they want? Now, if you can do that, the ownership's on the patient or athlete. What happens now? You're more rewarded. You're feeling now you can just unload. Now imagine having 20 patients or athletes like this. You're like, oh my gosh, now I'm just like fielding questions, setting expectations, figuring out the gaps. That's managing tough conversations. It's not about, hey, your rehab's not going well. That's already too late. That was your fault as a clinician. Truth of the matter. So if you really want to improve your outcomes, you have to take an approach that's higher level than the exercise. You're missing. They're looking at you, but you're not looking at them. Meaning you're so focused on one thing. They're literally trying to have a conversation with you, and they don't know how to ask a question. That's like a bad relationship. They want more from you, but you haven't had that conversation. Imagine somebody who wants to get married to you and you haven't had the conversation. What if you're like, I want to get married, you want to get married, but let's not talk about it. And that's what happens with patients and athletes. They're like, I want literally to be able to do this a little bit faster. Can you do this for me? But they're scared, rightfully so. And the PT's like, I don't want to look bad. I just want to see how I want to be the let's see how it goes PT. And then you don't ask that question. So there's a big gap in the relationship and you haven't managed those expectations. And that's what you're doing. Have that upfront conversation right from the beginning. It's what I do to my team. It's how I coach the PTs. It's how I get patients and athletes the outcomes they want. Now, you have to be able to do those exercises and everything else to like actually get the outcome. But if you don't set this, you're missing the whole framework on how you can help people at the highest level. And I know you as a PT, all you want is the best outcomes. You want to feel fulfilled. You want to have people like shouting your name. And if you can do this, you're giving yourself the best chance. If you're interested, this is how I coach, this is how I mentor. The big thing for people as they set the framework, I have several courses, and if you're like, hey, I could use some of this is kind of what I need. Like my current mentor or whatever is only giving me exercises. Consider taking my accelerator course. It is in March 18th and 19th, 2023. If that's for you, like it is all about acute injury management, setting the framework. It's all this higher level stuff. I'll give you exercises, give you all that, but ultimately giving you the framework so you can be successful as a PT, not just like taking it week by week and bored at work, not fulfilled. If you're looking for something different, this is for you. And if you want, go to my website, drchrisgarcia.com/accelerator. At that point, it'll give you a great opportunity to think outside the box, look for something different, and give you the best chances of being fulfilled. So nonetheless, I'm excited to see you there. It's virtual or in person, whatever you want. Either way, I hope you have a little kick in the pants. I hope you're enjoying work. And it's stuff like this that just keeps you motivated. Like you love what you do. You can see it at a higher level, what you do for people, and I promise you, people will appreciate you. Okay. All right. Sorry for that. That was a good rant. I'm very passionate about this, you guys, and I really hope you're implementing this. If you're not, it's only a matter of time before you do, because it'll be a game changer for you. All right. Enough of that. I will see you guys on the next episode. Take care.